Let's do hoarseness or hoarseness, and then we'll take a break. Hoarseness in the exam is not anything difficult. It's just like what we've been doing since, and it can present in any way and every way. Well, if you see a patient whose voice is already clearing, is going away, and the patient is a presenter in the AKT, the answer is vocal cord nodule. What's that? Voice overuse. How else can you see it in the AKT? Is a singer. The patient sings in church. The patient is a professional musician. Now the patient is talking, you are straining to hear. You can't hear what the patient is saying. They have strained their voice overuse. Your answer in the AKT is vocal cord nodule. Vocal cord nodule. Okay, I give you a patient who is a smoker, and the patient now, you can't hear what they are saying. There's some hoarseness, and you are still thinking it's cancer. Please, smoking on its own can cause hoarseness. How does it cause it? It causes it via a condition called Reinke's edema. Reinke's edema. By the way, in the AKT, if you see flu-like symptoms, the patient hoarseness is due to viral illness. So, smoker can have a hoarseness due to smoking. Pathophysiology, Reinke's edema. Fluid accumulates, put some pressure on the recurrent laryngeal nerve, they get hoarseness. If you see the same patient has flu-like symptoms, it is viral illness that has caused their hoarseness. I wouldn't think any of you will fail hoarseness after thyroid surgery. It's unheard of. It is recurrent laryngeal nerve palsy. The surgeon has damaged the recurrent laryngeal nerve. It's unheard of for a candidate to fail this in the exam. Please, none of you should fail it. Okay, how about a patient? It's not been up to 1 week. They've been having hoarseness. You examine the patient, everything is normal. That answer is laryngitis. Laryngitis is your well patient with hoarseness and no other thing linked. You've done a comprehensive examination, you can't find anything else. Pick laryngitis in your AKT, move on. Another thing you need to know in your AKT is that patient that has amenorrhea, cold intolerance, dry skin, she can have hoarseness as well. I know you people know that that's hypothyroidism. Hypothyroidism is a cause of hoarseness. So the clinchers in your AKT will be the clinchers of hypothyroidism, which will include cold intolerance, dry skin, amenorrhea. You see a patient known to have heartburns, they are having cough. Why can't you know that this answer is GERD? GERD is a cause of hoarseness in the AKT. GERD, let me just say, please pardon me. I'm not supposed to do this. Pardon me. Let me say one or two things about GERD. It's high yield in your exam, but it's high yield in your day-to-day practice. A patient with GERD will say, "Doctor, I've got something in my throat. I think I've got cancer." Tell the patient, "You've got faucet." Faucet is feeling of something in the throat. The patient comes, says, "Doctor, I'm getting chest burns. I don't know what to do." Please, the answer can be, the answer doesn't always have to be PPI. The answer can be antacid, trial of Gaviscon, trial of Peptac. Please, in the AKT, you need to know what doses for what PPIs. Omeprazole, when do we use 10 milligram, 20 milligram, 40 milligram? Lansoprazole, when do we use 15 milligram? When do we use 30 milligram? You need to know what a double dose is and what a single dose is. That is for gastro. That's not a topic for today. I just want to challenge you. GERD is high yield. When do you use the H. pylori? What are the indications for endoscopy? I once asked the candidate, what are the indications for endoscopy? The candidate said alarm symptoms. That is not the only indication for endoscopy. You need to be good. You need to know all the indications for endoscopy. By the way, alarm symptoms are the things you will hear and your ears will tingle. They are the things you will hear and you will become uncomfortable. A patient with heartburn, cough, GERD symptoms, with anorexia, you need to be worried. If that patient has weight loss, please be worried. If that patient has melena, please be worried. Alarm symptoms, you need to be worried. How about a patient presenting with hematemesis, vomiting of blood, Blatchford score? Same day referral to A&E, not same day, same time referral. That patient needs to be in A&E. They need to calculate the Blatchford score for them to know what to do next. Can it be treated in the community? Does it need an endoscopy? Most likely, yes. Blatchford score will help you with that. My friends, you need to be so good because hoarseness can come across neurology. If you are seeing hoarseness in neurology, it's a 41-year-old patient with dysphagia and difficulty walking. I asked a few candidates just a few days ago, they didn't get the answer. It's amyotrophic lateral sclerosis. By the way, motor neuron disease, we've done it. If you've missed it, go back. It's on the YouTube page. You can see it as it was one of our charity courses. We tried to do it very explicitly. So amyotrophic lateral sclerosis will be the answer. You need to know the types of motor neuron disease. There are 3 types, and you need to know what differentiates the 3 types. So again, you've seen this patient. She's very obese. Her BMI is 37. She said she gets hoarseness, which is worse in the morning. What do you think? Yes, if you said GERD, you're correct, because what has happened is the acid is flowing up when she's lying down. When she sits up and during the day, it goes away, the hoarseness disappears. That is GERD, my friends. Obesity plus hoarseness worse in the morning is GERD. By the way, for all your patients with gastroesophageal reflux disease, you need to be starting with lifestyle. What does that mean? Tell them to eat small, frequent meals. What does that mean? Tell them not to eat late night meals. What does that mean? Tell them not to take alcohol. What does that mean? Tell them to stop smoking. What does that mean? Tell them that weight loss is important. What does that mean? Tell them to stop taking NSAIDs like ibuprofen. What does that mean? Tell them to stop taking spicy food. Tell them to stop going to restaurants very regularly. Chinese. This is what it means to give a lifestyle advice, my friends. Lifestyle hasn't worked. Think H. pylori. Can it be a bug? That hasn't worked. Trial of PPI is on the guideline. You can try it for 1 month. That hasn't worked. You've seen alarm symptoms. There's something called Zollinger-Ellison syndrome. Oh, I don't want to do this. Zollinger-Ellison syndrome may be the reason for the patient's reflux. You need to be good. You need to know MEN 1, MEN 2A, MEN 2B. As I'm saying it now, the candidate is writing it down. The candidate says, I'm going to glance over it. You need to glance over it. If you are not writing it down, write it down. It may not be today, but tomorrow, spend 2 minutes. It's not very high yield, but know the 3 Ps in MEN 1. Know the ones in MEN 2. Know the ones in MEN 2B. You need to know them. Anyway, that's not our focus, and we're about to take a break. So let me just rush up on hoarseness. If you see a patient having hoarseness for greater than 3 weeks, it's cancer. I've been saying 3 weeks, 3 weeks, 3 weeks. Someone has not heard it. Now I've amplified it. 3 weeks, cancer. That cancer is likely to be a laryngeal cancer if you are still not sure of what I'm saying. If you see a patient, pain in the ear on swallowing, again, is laryngeal cancer if they have weight loss. Anybody that has dry mouth, dry eye, dry everything, it can also cause hoarseness because they will have dry throat. That is Sjogren's. What do you need to do? Artificial tears, artificial saliva, artificial lubricants, because they will have dry vagina, dry everything that has a mucous membrane will be dry. That is Sjogren's. The test there is Schimmel's test. Schimmel's test. It is not using an ordinary paper. It's not using cloth. It's using a filter paper. Schimmel's test. Please use a filter paper. If you've never heard of hoarseness in a patient with epistaxis and hemoptysis with saddle-shaped nose, it is also Wegener. This is the second time I'm talking about Wegener today. Wegener is C. anchor. I've told you the new name. If you are looking for Wegener, you won't see it. If you are looking for Chalk Strauss, you won't see it. Use the new name and you will see it in the exam and you will get that. I know I've said that you go for a break now, but can I just add one more thing before we go for a break? Because looking at the list of things we have to do, we'll spend a lot of time today, and that break is just 10 minutes. Can I just add polyps? Let's talk about polyps. It takes 2 minutes. Polyps is high yield, and there's not much for you to know about polyps. For example, the reason why I just wanted to talk about polyps is so that my strain of thoughts is not cut away. I've just talked about Wegener. Wegener is a topic that anytime I'm talking about it, when I start to talk about it, you will notice that I'm very excited talking about it. Why? It's usually not the answer in the AKT, but sometimes it helps you to exclude it out so that you can get the answer. So now I'm talking about polyps. I've just found out that Wegener is here as well. My friends, if you see polyps, you need to know the association. By the way, the association of polyps, the acronym is CACAS. CACKAS. If you are not writing, write that down. Although it's on your slide, there's something in writing down. It sticks faster and better. CACAS. CACAS is chalk straws. That's the first C. It is associated with polyps. I've just told you how. A patient who has chalk straws will usually have polyps. The A there is aspirin sensitivity. Aspirin sensitivity. There is a condition where, anyways, I'm going to talk about that, so let me leave that out of it. But aspirin sensitivity, think polyps. Aspirin will usually bring about polyps. By the way, why am I leaving it out? Let's talk about it now, because I may be rushing at the end. I may skip a group of things. So Samta's triad, you need to know it. Let's be frank with ourselves. There are certain triads you need to know in the AKT. One of them is Samta's triad. What is Samta's triad? Samta's triad is asthma with sinusitis plus nasal polyps. What's the trigger? Aspirin. Aspirin. So there's something that called aspirin-induced problems. One of them is Samta's triad. So a patient that has asthma, the patient that has sinusitis, the patient that has nasal polyps, think Samta's triad is your answer in the AKT. Back to the CACAS, which is at the associations with nasal polyps. I've told you chalk straws is the C. I've told you aspirin sensitivity is the A. C, another C is cystic fibrosis. Anytime you hear cystic fibrosis, think infertility. Anytime you hear cystic fibrosis, think long arm of chromosome. Is it chromosome 8 or 7? I can't remember now, but there's that chromosome you need to know. Anytime you hear cystic fibrosis, think Orkambi. Orkambi is the treatment. Orkambi is the treatment. You need to know these things. You need to be good. Anytime you hear cystic fibrosis, think that they can have recurrent chest infections. These are patients that must not come in contact with each other. Why? They can basically have what we call cross infection, which is very difficult to treat. There is an organism called Burkholderia capitia. Burkholderia capitia is a contraindication to lung transplant. Some of the organisms that you see in cystic fibrosis, my friends, think Staph aureus. My friend, think Pseudomonas aeruginosa. My friend, think Burkholderia capitia. There is aspergillosis. So I've forgotten that acronym. Let me try it again. S, A. So Staphylococcus is there. A is your aspergillosis. Your B is Burkholderia capitia. And your what's the last one? I said Pseudomonas. So I think it's SAB. Any acronym that you use to remember is fine. So far you remember. That is cystic fibrosis in the AKT. Again, the K in CACAS. CACAS is CACKAS. The K is Katagana syndrome. For Katagana syndrome, just remember three things. First thing, you need to remember dextrocardiac. They have their heart on the other side. They have what we call situs invertus. Instead of their liver being on the right, their liver is on the left. How can you fail it in the exam? The other thing you need to remember about Katagana syndrome is also infertility. How would the question come? The question is a lengthy question. It's a 36-year-old. They will write that the patient has been looking for a child for a while. Now the patient is also having nasal polyps. What do you want again, my friend? It's Katagana syndrome. Nasal polyps, infertility, dextrocardiac, Katagana syndrome. Nasal polyps, infertility, situs invertus, Katagana syndrome. Nasal polyps, infertility is still Katagana syndrome. Don't fail these things in the exam. I will be pained. Right. So the A there, the other A is asthma and the S is sinusitis. So that's CACAS. Those are the association with polyps. Now, that's not what I'm interested in. What I'm interested in is unilateral polyps, 2-week wait. it is likely neoplastic. Don't play with your GMC license. Unilateral nose problems, 2-week wait. The patient is saying, doctor, do I need to go to hospital? Say, yes, you need to go to hospital, my friend. I'm so sorry. I don't like to do this. In fact, I'm someone that likes to treat patients in primary care if I can. I can't. Tell the patient you are unable to. Why? It's likely a cancer. It's likely neoplastic. It's a 2-week wait, my friends. If it's bilateral, that can be fine. It's usually meant to be bilateral, so unilateral is something to be suspicious about, especially if the patient is Chinese. That is nasopharyngeal cancer. Right. Treatment of polyps is usually topical steroid spray, and that goes away. But if it's not going away, you've tried, it can be removed, what we call nasal polypectomy. Some people do what we call ethmoidectomy. What you need to do is refer them non-urgently after at least 2 to 3 months of steroids, topical steroid. Topical steroid can be fluticasone. Topical steroid can be beclomethasone. Topical steroid can be mometasone. It's just your normal steroids for sinusitis. Okay, I give you this child. This child has got a polyps. What do you need to do? You need to do 2 things. You need to exclude cystic fibrosis. How do you do that? The sweat test. You see, my friends, this is why I say sometimes it's counterproductive not to do a little here, a little there. If you also want to be focused, you just want to talk about ENT, you will be missing a lot. This is when to revise your cystic fibrosis. Where else does cystic fibrosis come out? It comes out in the newborn screening program. The acronym there is HMG-CoPIC. HMG-CoPIC. You can't fail it in the exam. So cystic fibrosis is one of the tests that is done at day 5 to day 9, AKT question. Someone didn't hear that. They can ask you, when do you do the monospot screening test? That's what it's called. Newborn screening test is day 5 to day 9. Do you know, I can't stop myself from telling you these things, because how will I be able to sleep? That I was talking about cystic fibrosis today, I have not mentioned these things to you. It's unfair to you. My heart will prick me, my conscience will prick me. I need to let you know it. I need to tell you a couple of times. If I've told you 5 times and you deliberately fail it in the AKT, that's fine. That's you. But I need to tell you. Another thing you need to look out for is meningocele. Whenever I'm doing 6 weeks baby check, I go head to toe. One of the things I talk about is meningocele. From the head, check the anterior and posterior fontanelle. Are they okay? Does the child have frontal bossing? Is sickle cell? Look into the eyes. Are you seeing absence of red reflex? Think retinoblastoma, my friend. Saddle-shaped nose, Wegener. You look at the jaw of the child, it can be many things. First of all, before you look at the jaw, look into the mouth. Cleft lip and palate is something that you need to refer back to the pediatrician. How does the pediatrician even miss that? It is usually a child, in the AKT, it's usually a child that has come from Sudan to the UK. It's usually a child that has come from Malaysia. The pediatricians don't miss cleft lip and palate. By the way, it's difficult for you to see things like cleft lip and palate in the UK, because the patient usually asks, can I take this medication? Can I take this medication? What medication is the mom taking? Phenytoin. Look at that. Phenytoin is high yield in the AKT. It is part of your neuro. If I do not teach phenytoin and I do not teach cyclosporine, I will not end the AKT teaching. Cyclosporine causes everything to be big. It causes hypertrichosis. It causes gingival hyperplasia. It causes muscular hypertrophy. Everything is big in cyclosporine. Meanwhile, phenytoin, the acronym for phenytoin is phenytoin. I'm not going to do it now. It's going to take so much of our time, but you need to know these things. So back to our topic. If you're doing a 6 weeks baby check the mouth. Is there a mouth deficiency? Go to the neck. What can you see on the neck? It can be web neck, Turner syndrome. It can be web neck. That's the other girl that I told you I forgot. Her name is Nunans. Nunans is the sister of Williams. In the AKT, the question for Williams is hypercalcemia. He's a friendly boy. A friendly boy with hypercalcemia equals Williams. A girl that has pectus excavatum, her chest is pointing outward. This girl is short statured. She has a web neck. but she doesn't have the features of Turner's, is Noonan's. While Williams has supraaortic valvular stenosis as defect, Turner's has pulmonary stenosis as her Noonan's has pulmonary stenosis as her own defect. You can't fail it in the AKT. How do you fail these things? I don't understand. Turner's is that short girl. She has widely spaced nipples, broad chest, ovarian dysgenesis, heart-shaped kidneys. She has cystic hygroma. How do you fail it in the exam? They want to help you. They say, well, these questions are too hard. Let's give them some simple questions. Let's ask them the commonest heart problem in Turner's, and you go and choose coarctation of the aorta. Don't tell anybody in this easy learn that you failed the question. The answer is bicuspid aortic valve. 15% common. Coarctation of the aorta, 9% common. How many times will I say it? Okay. Now you've gone away from the neck, you go to the chest. What can you hear in the chest? PDA. PDA, you hear machinery murmur. That's the clincher. What else can you do when you're in the chest? Please check for radiofemoral delay and radioradial. That's coarctation of the aorta, my friends. By the way, there's nothing in the chest. You're happy with the chest, no pectus excavatum, no abnormality. So you go to the abdomen. As you get to the abdomen, just at the upper right quadrant, you can feel something. It feels like an olive mass. How do you fail that question in the exam? How do you not get pyloric stenosis in the exam? You feel something in the upper right quadrant, olive-shaped mass. You should know what it is, my friends. Okay, you go down, the abdomen is a bit distended. You try to feel it, you are feeling something as if something is telescoping into something. That's intussusception. I'm sorry I've gone into pediatrics, but I just want to tell you about the 6 weeks baby check because I need you to hear it at least 2 or 3 times. It will be the answer of one of your questions in the AKT. If you go down a bit, you can see undescended testes. If both testes are undescended, please, it's same day. Same day. If it's one testis, you can refer later, but if it's 3 months, if it's 2 testes, same day. Don't fail it in the AKT. 3 to 6 months, one testis, it may still descend. If after 6 months is not descending, refer. But if it's both testes, you are joking with a GMC problem. If you don't refer same time, it's super urgent. Why? That child will come in future and say, well, my infertility is due to this doctor. I need £1 billion. Your defense union will not be able to argue. They will pay it out. That is a grievous mistake. So 6 weeks baby check is not when to play. 6 weeks baby check is not when to miss out developmental dysplasia of the hip. Please check. How do you check? A candidate is saying, yes, I'm trying to check, but I don't know how to check. It's BADO, BDOR. That's the test. Barlow displaces, Ortolani replaces. Use Barlow to displace the hip and use Ortolani to replace the hip. What's the treatment? Pavlik harness. Someone is saying, I've not heard it before. Write it down and read it. That's not our focus today. What can you see in the legs of the patient? They can have Talipes equinovarus, club foot. By the way, they can have all sorts of knee problems. But the only thing that led us to all these things is meningocele. What else can be on the back of the child? Gastrochisis. I know you've heard this before. It's just skipped your memory. I know you've heard this before. You've just forgotten. This is the time to revise. Back lumps, spinal lumps, gastrochisis, meningocele. Please make sure that the patient's anus is patent. Otherwise, what have you done? A 6 weeks baby check. Okay, let's leave that. This was nasal polyps that took us to all this. I'm sure with nasal polyps, all of you now know the management. All of you now know when you see a child, what to exclude, cystic fibrosis and meningocele. All of you have heard of the Samta's triad. All of you know it now, and all of you know the associations with polyps, which is carcass. The only thing I'm going to stress on again is any unilateral nose problem, 2-week wait. Right? I'm sure some of you's head are fried. Some of you need to take some coffee. Some of you need to take some tea. Some of you need to take breakfast. I'll give 10 minutes. We can extend to 15 minutes for you to rest. Please bear with me. There is no time again. we can as well do ENT today. We call it ENT 1 and do ENT 2. There's no time again. ENT is not a topic where we'll do ENT 1 and 2. We'll finish today. Just give a bit more time. We'll finish soon. So please go for a break. Stay on the link. Go for a break. Mute yourselves. Mute yourselves. Go for a break. Come back in 10 minutes and we'll continue. By the way, before you go, if there's any quick question, I can quickly take. Otherwise, I'll take questions at the end. Anybody worried about anything just now? No. Okay. So let's go for a break and then I'll see you guys in 10 minutes. Thank you.